In this abstract, we are presenting the updated results on the combination of Isatuximab, Bortezomib, Lenalidomide, and Dexamethasone for newly diagnosed patients with multiple myeloma that are not eligible for transplantation, or at least that they do not have an immediate intent for autologous stem cell transplantation. So we know that quadruplet therapy is now the standard of care for transplant-eligible patients, but now we are starting to see or to test if these quadruplets are also feasible for elderly patients. And this is what we are doing here with this combination with an anti-CD38 monoclonal antibody Isatuximab with VRd. So these patients, were initially treated with this Isa-VRd in a usual schema. And this was the part EA of the study, was a weight-based infusion of Isatuximab. So the conventional infusion of Isatuximab. But what we are now here reporting is the part B of the study, which is 46 patients that received a fixed volume infusion of Isatuximab. So it's a different method of preparing and infusing Isatuximab. So in total, as I said, 73 patients were included in the trial with this combination, but we are now focusing on the 46 with a fixed volume infusion. What can we say about this fixed volume infusion? First is that we reduce the infusion duration. So if we compare the part A with the conventional method with the part B with the fixed volume infusion, we can see from the second and the subsequent infusions, we decreased from almost 1 hour the duration of the infusion. That was 2 hours for the second infusion and 1 hour and 20 minutes for the subsequent infusion. So we clearly shortened this duration of infusion. The second point was the safety. And we can say that this Isa-VRd is quite safe. It's well tolerated for patients with non-transplant eligible patients with multiple myeloma. The rate of treatment-related adverse events, treatment emergent adverse events was quite low. We could focus on the grade 3 and 4, so non-frequent non-hematological toxicity. And also there was quite well tolerated in terms of hematological toxicity. So convenience or short duration of infusion, safe, and finally, of course, we have to speak about the efficacy of the combination. And we can say that in this Isa-VRd, this quadruplet resulted in almost all patients responded, 98% of the patients responded, with 53% of them, that was in fact the primary endpoint, achieved complete response. Also, we had the opportunity to check the MRD, and we see that 50% of the patients, more than 50%, achieved MRD negative. So, and the rate of immunophenotypic CR was 42% for these patients. Only one additional comment that is about infusion-related reactions, and we were able to decrease also with this fixed volume infusion of the infusion-related reactions from 52%, the majority of them in the first infusion, in the part A with the conventional administration, we decreased from this 52 to 22% with the fixed volume infusion. So I have to say that I think with this quadruplet, with this new method of infusion of Isatuximab, we have a combination with it which is convenient for patients, it's safe for them, and also I think quite effective.